I'm sorry, till now it is not recorded. Hope you will get the recording from here. So anyway, this is the continuation of yesterday's class itself. So concept is same. You have to know how to identify the points for all the meridian. If you get to know one meridian, then you can start plotting, or you can start using the same concept for all the meridians. So triple warmer meridian, again TW 13, 14 will come again near the shoulder joint. TW from TW 15, 15 will come here near the neck. 16 will go behind the ear. It will take a circle behind the ear, and then it will end on the outer part of the eye, or where these eyebrows end, right? This is TW 23. This is the last point of triple warmer meridian. So this is the last point. So totally there are 23 points in triple warmer meridian. It will start from the ring finger, and then it will end near the outer part of the eye. So there are totally 23 points in triple warmer meridian, and the timing for the triple warmer meridian is from 9 p.m. to 11 p.m. You have to remember, all of you all have to remember these timings for all the organs. And coming back to the correspondence, if you see page number 180, because it is the hand meridian and it will pass on the yang side of the hand, that is back side of the hand. So this is your hand finger as per the correspondence. So TW1 will come here in the center below the nail. TW1, 2, 3. These TW2 and 3, all the 3 points actually, it is used to treat any kind of hormonal imbalance. TW1, 2, 3. TW4 will come on the joint again. Again, you have to know how to move your probe. Below the joint, when you move the probe, you'll get the pit here. This pit is TW5. This is TW5. Just below TW5 is TW6. TW6 is again an important point to treat in or to remove any kind of stagnation anywhere in the body. TW6 is again important, which will come just below TW5. And as you go down, or after TW6, like K8 or K6, this TW7 will come in between the center line and the corner line. Center line is the triple warmer, and this corner line towards the small finger is small intestine. So it will come in the center of the center line and the corner line. That is TW7. Again, you have to go down, that is TW8. There's no gap between these points. Just below TW8 is TW9. And then, as I've told in the original point, you will get TW10 just below the joint. Again, you have to move your probe. You'll get the pit here, that is in the center, TW11. Again, if you come down, you'll get the pit here, TW12. TW13, like yesterday I've told for LI meridian and SI meridian, TW13 will come just above this bone. When you fold your hand, or when you fold your fingers, so this you will find this bone. Just below this bone, you will get the pit here, that is TW13. And on the bone, exactly on the bone, you will get TW14. This point is TW14. This is TW14 on the bone. And when you come down, you have to move your probe from the center. When you move your probe, this pit, again you will get the pit here, that is TW15. Yesterday we have seen SI meridian. From here we moved the probe, and here it was SI11 on the GV12 line. So in the same way, from TW14, when you move your probe, you will get the pit here, that is TW15. Again from here, when you go, you have to come back to the thumb, here in the center of the thumb, center of the thumb in the sense between these two joints, exactly in the center, this line is TW16. Center GB line you will get, next to that is UB line, next to that is TW16. 17 will come on the joint again. This point also is important to treat migraine related disorders, can be treated with TW17. TW17, 18, 19, 20. There's no gap here between TW17, 18, 19 and 20. And then from TW21, you have to come to the inner part of the thumb. As it is passing behind the ear, you have drawn the ear correspondence. So you will get all those points here near the ear region on this side. So there's no much gap between those points. So TW21, 22, 23, any kind of ear related issues, you can use these points along with SI 19 as I've told yesterday. So this is about triple warmer meridian. I'm sorry, I'm going fast because of lack of time. And next we'll go to gallbladder meridian. According to the organ clock, the time is 11 p.m. to 1 p.m. for gallbladder meridian. Again, come to page number 147. Gallbladder meridian GB1 will start here on the outer part of the eye. Near the eyebrow, this pit is TW23. Below this, in the corner, this is GB1. Again, GB2 will go back near the ear, GB3, and it will go to the head, GB4. Again, it will take the circles, multiple circles will go, multiple parts are there in the head region for gallbladder meridian. So almost 2 to 3 rounds it is taking, entire gallbladder meridian. From GB to GB4 to almost gallbladder 20. Gallbladder 20 will come here almost at the end of the head region or this joint. So this is GB20. GB21 will come here near the shoulder joint in this pit. Not exactly on the joint, slightly on the back side of the joint. You'll get the pit here, that is GB21. GB21 again is important. It can treat other problems also, but important use of GB21 is if someone is having one leg shorter and one leg longer, you can make them lie down on a flat surface, and you can apply pressure on this original GB21 point on the shorter side. Means which leg is shorter, you have to see, you have to make the person lie down, and you have to see which leg is shorter, and on the shorter side you have to apply pressure on GB21 on the original point. So immediately you can see the difference between both the legs. So that is GB21. Again GB22, 23, 24, it will come, it will pass along the ribs region till GB, and from GB30 it will start from the leg again, from the hip region. UB50 it will pass on the back side of the leg. GB30 again it will pass on the outer side of the leg. So from GB30 when you come down, GB31, 32 on the thigh region, 33, 34, it will come just above the knee and below the knee. GB36, 37 again near the calf muscle, 38. GB40 again near the ankle joint. 41, 40, 41, 42, 43, 44, you'll again it will end on the fourth toe. that is the toe next to the small toe. GB44 again it will come at the nail base towards the small finger. This is the original flow of gallbladder meridian. When you come to the correspondence part, like we have seen, GB1 will start here on the outer part of the eye. So this is your eye correspondence. So this is the inner part. As you have seen, UB1 will start here, inner part. GB1 will start here on the outer part. GB1 will start here. GB1, 2, there's no much gap between, because the size is very small. There's no much gap between the points GB1, GB2, because GB1 will start here and it will go back near the ear. So GB2 again it will go back near the ear. 3 again it will come up till GB4. You can see in page number 180, 180 and 181. So on the front side, from GB1 to GB4 again it is coming up. GB1 will start here on the outer side of the eye. It is going up till GB4. Again it is coming down till GB7. Again it will go on the back side of the palm. GB8, because it is rotating across the head from front and back. So it is again, it went on the yang side, GB8, GB9, exactly as you marked triple warmer meridian, exactly next to that you will get GB meridian. So it will take a circle there. Means there's no gap between the points GB8, 9, 10, 11, 12. Again, GB13 will come on the front, on the tip, here near the tip. GB13, 14, 15, it will come here on the near the corner of the tip. And GB16 will come here again in the tip. Again, GB17, you have to go back. For GB17, again on the yang side, you can see your books. GB1 to GB1 to GB7, you will get it on the inside. You can make a note of it. GB1 to GB7, you will get it on front side. GB8 to GB12 on the back side. GB13 to GB16 again on the front side, here near the corner. GB17 onwards, again it will go back. So GB17 and 18, 19, this is the UB line next to the center. Next to that is GB line again. 18, 19, GB20, you will get just above this joint. This is GB20. Exactly above the joint is GB20. GB20 also is an important point to expel wind. Single point to expel wind in the body is GB20. So this is also an important point, GB20. And again for GB21, you have to close all your fingers like this. Close all your fingers. From this joint, hope it is visible, from this thumb joint, when you move like this, you can see the pit, not pit, exactly where this joint ends. So this point is GB21. This is GB21. So again, after GB21, again it will come in the front. Again GB22 will start from here. You can take the CV line as reference again for GB22, 23, 24, 25. 24 will go down again near P1. Usually these are very rarely used points. We will not use these points. So this is from GB22 to 23, 24 will go down again. 25 will come here exactly in the corner of the thumb joint. 25 again. and you can use these points. 25, 26. You can take CV line as reference. Again, it will parallelly come in the line of CV6. 27, 28, 29 here on the bone. These 3 points will come here on the bone. 27, 28, 29. These points are also used to treat heel pain. GB 27, 28, 29 are also used to treat heel pain. Again, GB 30, it will come on the yang side of the hand, just above this joint. When you fold your fingers, you'll get this joint. From this joint, if you move your probe again, you'll get the pit. So this pit is GB 30. Below that, you have seen UB points. You have seen UB 30, again UB 31, 32, 30, 33, 34, and 35. So above that is GB 30. Again, when you move your probe, you'll get the pit here. Your probe will exactly stop at that point itself. So that is GB 31. Exactly after that is GB 32. And below this joint, this is GB 33. And above the joint is GB 34. These 2 points are very good for treating knee pain. So if you want to treat knee pain or chronic knee pain, you can apply sedate GB 33, 34, QB 54, stomach 35, and stomach 36. So any knee pain can be treated with these points, local points. GB 34, again when you move your probe, you will get the pit here, that is GB 35, and exactly above that is 36. 36 will come again in the center between the center line and the corner line. That is GB 36. 37 will come back to the center again. 38, 39. GB 39 also is very good to treat gas related problem. GB 39. GB 40 again on the joint. GB again, you have to divide the points equally from GB 40 to GB 44. GB 44 is the last point for gallbladder meridian. It will come exactly just below the nail. That is GB 44. So coming to the last meridian, that is liver meridian. So according to organ clock, time of liver is from 1 to 3. That is the last cycle, 1 a.m. to 3 a.m. So totally there are 14 points in liver meridian. Coming to the original point, you can come to page number 150. In page number 150 of treatise 1, liver 1 meridian is the leg meridian. It is an in meridian, and again it will pass along the leg. It is starting next to the nail base in the corner towards the small finger. So liver 1, 2 will, like we have seen triple wormer in hand. Liver 2 will come above the joint. Liver 3 again on the tarsal bone in that pit. You have to identify the pit for liver 3. Liver 4 near the ankle joint again. Again it will go up. Liver 5, 6 near the calf muscle. 7, 8, 9. And again if you go up, liver 10, 11, 12 will come near the pubic bone, pubic region. Liver 13 and 14 will end just below the diaphragm line. So this is the original path of liver meridian. Totally there are 14 points in liver meridian. Coming back to the correspondence, when you have to apply the points on liver meridian. So come back to page number 180 or 179. Again, liver meridian, as I've told, like kidney meridian, liver meridian will come towards the index finger. Again, it will come in the liver 1 will start here near the corner of the knee. This is liver 1. Just below that is liver 2. Liver 3 is just below that. Liver 4 will come on the joint. Liver 3 is also important point to treat liver related disorders. Liver 4 will come on the joint, and from liver 4, if you move the probe here just below the joint, you'll get the pit here, that is liver 5. So liver 5 is also an important point to treat itching in genital region. So if there is any itching in genitals for both male and female, you can use this liver 5. Again, just below liver 5 is liver 6. And from liver 6, again it is taking a deviation. It is going back to the center. Just above the line is liver 7. And on the joint, you will, in the center, you will get liver 8. This center point is liver 8. Liver 8 is also an important point to treat muscle muscle related problems, or if you want to gain weight or if you want to increase your muscles, you can tone liver 8. Tonification point of liver. This is tonification point of liver. Yes, for itching in genitals, you can set it liver 5. And again, when you come down, when you move your probe, you'll get the pit again, that is liver 9. And when you come down just above the line, you will get 2 points, liver 10 and liver 11. Liver 10 also helps in treating insomnia for women. If any women or for ladies, if they are having insomnia problem, you can treat liver 10. Liver 12 again on the joint. For liver 13, from here you can move your probe like this. From the corner of the thumb, you can move your probe like this. You'll get a pit here. That is liver 13. It will come parallel to CV8. This is liver 13. Parallel to CV8 and in the center of this index finger. From here vertically, if you see in the center of, it will come in the center of the index finger and parallel to CV8. Or you can move the probe from here. This is liver 13. Or easy way to, even more easier way to identify liver 13 is when you fold your index finger like this, you have to fold the index finger of patient's hand. If you are applying liver 13 to any patient, you can ask the patient to fold the finger like this. This is liver 13. And when you fold the index finger like this, see, this is 13 and this is liver 14. You can ask the patient immediately, just if you immediately fold the index finger, that is liver 13, and when you stretch the index finger and then fold, this is liver 14. Easy way to identify liver 13 and 14. Even these points are also used to treat liver related disorders. So this is the end of Chinese acupressure. Hope all of you all have understood these meridians. I've tried to convince as much as possible, means tried to explain as much as I can explain. So next we'll go to Ayurvedic acupressure. So in Chinese, we have seen the correspondence and we have seen that there are two diaphragms in Chinese or Suzhou correspondence. Coming to Ayurvedic acupressure, you have only one diaphragm. You have only one diaphragm, and that is, and even in Ayurvedic acupressure, you have to always keep your hand like this. You should not keep your hand like this or you not like this. Always you have to stand. You have to make these fingers stand. So these two will be your leg again. These two will be your hands. This will be head and neck region. This remains the same in Ayurvedic acupressure correspondence also. And this will be your shoulder joint, elbow joint, wrist joint. And for leg, this will be your hip joint, knee joint, and the ankle joint. So this will be your left hand, left leg, right hand. Similarly, left hand, left leg, right hand. So this is for hands and legs and head and neck region. Coming to the diaphragm, you have to take, see, this will be the diaphragm line. From the corner of the thumb, you can draw a straight line. If you are having pens with you, you can also draw this line. So this will be the diaphragm line for Ayurvedic acupressure. This is the only diaphragm which is there in Ayurvedic acupressure, according to Ayurvedic acupressure. So this is the diaphragm line, and organs above the diaphragm can be treated here on this bulge part. This is your chest region. So you will get both the lungs here. So when you keep it like this will be your left lung, this will be your right lung. When you want to treat the lungs, you can apply pressure at this point, and here you will get heart which is slightly tilted towards the left. Hope it is visible to everyone. So this is the diaphragm line. Above the diaphragm, organs are plotted here on this bulge part. These two are the lungs and heart slightly tilted towards the left. Below the diaphragm, here you will get the liver. This is the liver and gallbladder here. And next to that is stomach, spleen, and then below that is large intestine. This is your large intestine part. It will start from here between small finger and ring finger. So this is your large intestine, and in between that is your small intestine. So this is the first part of large intestine appendix. It will go again, it will go in the upward direction, ascending colon, then like this, descending colon, and it will end here. Again, anal hole will come at the back where we have plotted GV1, that is the anal hole. Here we'll get the reproductive organs and then the urinary bladder. Below that is reproductive organs and the urinary bladder. In the same way, backside, this is your spine, cervical, and then similarly, like what we have seen yesterday, your thoracic region will come here, lumbar region will come here. Yesterday, kidneys we have seen in this path between index finger and middle finger, we have passed through this path, and this pit we have seen kidneys. But according to Ayurvedic, it will come in the corner like this on this side, on the index finger side. This pit is your left kidney. And whenever you are plotting kidneys also, you have to keep your hand like this. So towards index finger, what you get is your left kidney. Towards small finger, what you get exactly at the back, this is your right kidney. So this is the correspondence according to Ayurvedic acupressure. It is also given in your Bharadwaj book, which is given in first semester in page number 4. You can refer page number 4 in this Bharadwaj book. So complete correspondence is explained in page number 4 as I have shown here. You have to remember that this is the diaphragm line. So if they ask in Viva, they might ask you according to Ayurvedic where is the diaphragm line, and according to Sujok where is the diaphragm line. When they ask according to Sujok, you have to tell them that there are two diaphragm lines, and according to Ayurvedic acupressure there is only one diaphragm line, and above the diaphragm organs are plotted here on the bulge parts, and below the diaphragm are plotted here below the diaphragm line. This is your liver, stomach, spleen, large intestine, small intestine, urinary bladder, and on the back, spine and kidneys. These two are kidneys. And the figure is given in your Bharadwaj book on page number 4. So this is the correspondence part. Again, similarly as in Chinese acupressure, we also have meridians in Ayurvedic acupressure also. So in Ayurvedic acupressure, there are 3 types of meridians: vertical meridian, horizontal meridian, and spiral meridian. These are the basic 3 meridians, and then these meridians are only elaborately done, or other long vertical, long horizontal, all these sub parts will come under these meridians only. So main meridians in Ayurvedic acupressure is vertical meridian, horizontal meridian, and spiral meridian. For before that, as you all know, there are 10 elements in Ayurvedic acupressure. You can refer page number 16. You can refer page number 16 in Bharadwaj book. So as you all know, there are 10 elements in Ayurvedic acupressure. In Chinese, we are having 5 elements, but in Ayurvedic acupressure, we are having 10 elements, which are in that 5 are physical elements and 5 are metaphysical elements. Means they are not visible to our eyes. So it will start from 0 to 9. There are 10 elements. It will start from 0 to 9. First 5 elements. 0 is thumb, which is again metaphysical element. Physical elements, you can make a note of it. Physical elements are Akash, Vayu, Agni, Jal, Prithvi. These are the 5 physical elements: Akash, Vayu, Agni, Jal, and Prithvi. Kal, Disha, Man, Tam, and Atma are the 5 metaphysical elements. These are the 5 metaphysical elements. So you have to know there are 5 physical elements and 5 metaphysical elements. Coming to the fingers, you can plot these elements in both the hands. So coming to the finger, starting from the right, this is 0. Please remember the numbers first. This is 0. You have to always start from your right thumb, and the next tallest finger in your right hand is small finger, that is 1. So this is 2. Again come to the left hand, this is 2, and the next tallest finger in the left hand is index finger, that is 3. Again coming to the right hand, right index finger is 4. Next tallest finger is your ring finger, that is 5. Again come to the ring finger on left hand, that is 6. Next tallest finger in your left hand is 7, and then 8. 9 is again the thumb on the left hand. Hope all of you all have understood. Start with the right thumb, 0. Go as per the size of the finger. So this is 0, 1. Small finger again on the left hand, this is 2, finger number 2. Again next tallest finger is index finger, 3. Index finger on right hand, this is 4. Next tallest finger is 5. This is ring finger is 5. This is 6. Next tallest is 7 and 8. Last one is 9, which is on the left thumb. So these are the finger numbers. You have to know these finger numbers also, because all the organs are plotted, all the organs and elements are plotted in these fingers only. So coming to the elements, 0, as you all know, 0 is thumb. Thumb, Akash, 1 is Akash, 2 is Vayu, 3 is Agni, 4 is Jal, 5 is Prithvi, 6 is Kal. Again, from 6 you will get metaphysical elements. 6 is Kal, 7 is Disha, 8 is Man, 9 is Atma, that is soul. So always you have to start from right thumb. Thumb, origin, this is thumb, 0, Akash, Vayu, Akash, Vayu, Agni, Jal, Prithvi, Kal, Disha, Man. You can easily remember Akash and Vayu as small fingers, Agni, Jal, index finger, Prithvi is ring finger next tallest, Kal, Disha, Man, and this is Atma. So you have to remember these elements and the finger numbers. You have to practice these things, because I'm explaining how to remember it easily. So you have to go as per the size of the finger. Start with the right thumb, Akash, Vayu, Agni, Jal, Prithvi, next tallest after index finger. Akash, Vayu, Agni, Jal, Prithvi. This is Kal, Disha, Man. Kal, Disha, Man. And last is Atma. So these are the elements which are located in your fingers. Always you have to remember 1, 4, 5, 8 will come on the right hand. 0, 1, 4, 5, 8 on the right hand. 2, 3, 6, 7 on the left hand. 1, 4, 5, 8. 1, 4, 5, 8. Always you remember 1, 4, 5, 8. Other things will come in your left hand. 1, 4, 5, 8 on the right hand. 2, 3, 6, 7 on the left hand. So first we'll go to vertical meridian on page number 21. Please go to page number 21 in your Bharadwaj book. So they have given the vertical meridian in the original body. So 0 will come in the center. As I told, 1, 4, 5, 8 is coming towards the right. 2, 3, 6, 7 is coming towards the left. So it is passing vertically from down to up. So 0 in the center, 9 at the back, 1, 4, 5. You usually use these vertical meridians when you want to treat any organ or any area vertically. Suppose if you have pain only on the right side, so you can take this fourth vertical and you can select the points as per the problem. So you use these vertical meridians based on the area, or based on the area you can use these vertical meridians. So original location of the vertical meridians is given in page number 21. Coming to the correspondence, all the vertical meridians will be same for the all the points. So the center line is 0 vertical meridian. 0 vertical meridian will come from 0 down to, it will go from down to up. It will flow from down to up. This in the center you will get 0 vertical meridian. 1, 4, you will come in the front. This is 1, 4 towards the thumb. Always 1, 4, 5, 8 will come towards the thumb. Always you have to remember this point. 1, 4, 5, 8 will come towards the thumb. This is 1 and 4. This is 2 and 3. 2 and 3. I'll try to draw it and I'll show it to you. Hope all of you all are able to see the screen. So assume this as your finger, any finger, either index or middle or ring. So this is your thumb. So these are the joints on the finger. You can call, this will be your Vat joint. This is Pitta joint. Sorry, this is cuff joint. This is cuff joint. This is Pitta joint. Middle one is Pitta joint. Upper joint is Vat joint. And again, this is the back part of the finger. So you will have the nail here. I'm sorry, diagram is not good because I'm showing it, drawing it on the using the mouse. So this is your index finger. Assume it as index finger, left index finger. So this is your thumb. In the center, you will get 0, 0, 1. This is 4. This is 0 vertical meridian will go in the center. This is 1 vertical meridian. This is 4 vertical meridian in the corner. Again, this side you will get 2 vertical meridian. This is second vertical meridian. It will go from down to up. This is 3 vertical meridian on the corner. So this is 2 vertical meridian. This is 3 vertical meridian. 0 vertical. This is 0 vertical meridian in the center. 1 will come, 1, 4 will always come towards the thumb. 2, 3 will come away from the thumb. So in again coming to the back side or yang side, you can see in the center you will get 9 vertical meridian. Like in the center you have got 0 vertical meridian on the front side. On the back side you will get 9 vertical meridian. This is 9 vertical meridian. Again towards the thumb. Assume this is the thumb back side. Towards the thumb, this is in the corner you will get so in the corner you will get 5 vertical meridian and next to that is 8 vertical meridian towards the thumb. This is 8 vertical meridian and this is 5 vertical meridian. And on the opposite side, that is towards the small finger, you will get 7 vertical meridian and on the outer side, this is 6 vertical meridian. You can also refer page number 22, which is given in your book. So hope all of you all have understood. First, remember front and back, 0 vertical in the center, 9 vertical at the back. 1, 4, 5, 8 will come towards the thumb. This is one. Always you have to remember this 1, 4, 5, 8 towards thumb. 2, 3, 6, 7 is away from the thumb. 1, 4, 5, 8 is towards the thumb. 2, 3, 6, 7 is away from the thumb. So you have to always know 0 is in the center on the front side, that is inside. 9 is in the center on the yang side. Again, in each vertical meridian, there are 10 points. There are 10 points because there are 10 elements. There are 10 points in each vertical meridian. So 0 will start from here. 0, 3 will come on the joint. 6 will come again on the joint. 9 at the tip. When you see in your hand, suppose this is your hand, this is the vertical meridian, 9 will come here. This is 9. So 0 on the cuff joint, 3 on the pitta joint, 6 on the vat joint. So in between this, you have to equally divide 2 points. That is, in between pitta joint and cuff joint, you have to equally divide 2 points. That is point number 1 and point number 2. Again, in between pitta joint and vata joint, you have to equally divide the points. That is point number 4 and point number 5. And 6 on the vata joint, you have marked 9 here. Again, you have to divide the points equally, 7 and 8. So 0 vertical meridian, always it will flow from down to up like a rocket, always from down to up. This is normal flow. This is normal flow. So this is 0 vertical meridian. You have got 10 points in 0 vertical meridian. So 0, 3 on the joint, pitta joint, 6 on the vat joint. 0, again equally you have to divide the points 1 and 2. Again here after 3, 4 and 5. Here in the corner you will get 9. So 7 and 8 you have to equally divide the points. In the same way, there are 10 points for each meridian. There are 10 points. As you have plotted all the 10 points on 0 vertical meridian, I want, if you all are having pens with you, I want all of you all to draw a line and mark all the 10 points in your finger. On all the 10 points, 0 will start here in the cuff joint, 3 on the pitta joint, 6 on the vat joint. So 1 will come here again. So this is 0, 3 on the joint. You have to equally divide 1 and 2. 3 on the joint. 6 on the joint again. In between these two, you have to equally divide the points, that will be 4 and 5. 9 will come here, 7 and 8. Yes, correct. So these are the points. Hope you have got this vertical meridian. This is on the fingers. In index finger, middle finger, ring finger and small finger. Only thing you have to remember is 1, 4, 5, 8 will come towards the thumb. And there are 10 points in each finger. Suppose if there is a protocol say called something like if you want to mark point number 4 and 5 in third vertical meridian. So I want all of you all to draw or plot point number 4 and 5 in third vertical meridian. So which is your third vertical meridian? Suppose finger number 2, protocol says protocol will be in this format. Finger number 2, third vertical meridian, 4 tone, 5 sedate. So which first you have to go to finger number 2. Which is finger number 2? This is finger number 2, third vertical meridian, which is third vertical meridian away from the thumb. 3 is away from the thumb. So you have to draw an imaginary line. In Ayurvedic acupressure, there's no concept that magnet should be visible after applying the points. It can even go to the side. You have to equally divide 5 points in the front and 5 points at the back. So this is third vertical meridian. In third vertical meridian, identify point number 4 and 5. You can go from down 0 in the cuff joint, 1, 2, 3 on the pitta joint. After 3, you have to equally divide the points. 4, this is point number 4 and this is point number 5. Hope it is visible to everyone. Even I'll erase this and I'll show it once again. Suppose if this is your finger, this is your finger, assume this is back side, this is the thumb. So if there is protocol like we have finger number 3, fifth vertical meridian, point number 3 and 7, 3 tone, 7 sedate. So which is fifth vertical meridian? 5 will come towards, see, 0, 0 in the center, 1, 4, 5, 8, 9 in the center. So this is fifth vertical meridian towards the thumb. So on fifth vertical meridian, 3 and 7, this is fifth vertical meridian. So point number 3 will come here on the joint, 7 will come, this is 6 on vad joint, and 7 will come just above the joint. So when you see this is 3, point number 3 on pitta joint, and point number 7, yes, on above the vad joint on fifth vertical meridian. Fifth vertical meridian will come on back side of the hand. Fifth vertical will come on back side of the hand. 1, 4 will come in the front. 5, 8 will come at the back, yang side. Again, 2, 3 will come in the front, away from the thumb. 6, 7 will come in the back, yang side. You have to always remember this concept so that you can easily plot any point on vertical meridian. 0, 1, 2, 1, 4, 5, 8 towards the thumb. 1, 4, 5, 8. Always remember this sequence. 1, 4, 5, 8. 1, 4, 5, 8. It is helpful for plotting all the meridians, not only vertical meridian, even horizontal meridian also. So this is vertical meridian. And in each vertical meridian, you will get 10 points. Hope all of you all have understood this vertical meridian concept. Even diagram is also given in page number 22. Next, we'll go to horizontal meridians. It is given in page number 23. Horizontal meridian will go horizontal. Vertical meridian you have seen like a rocket. It is going from down to up. Horizontal meridian is like a cylinder or a circle. It will rotate. It will rotate from front to back. So again, zero vertical, there are 10 points in zero vertical meridian. So here you have seen so again assume this as your finger. Assume this as your joints. Figure is not clear. Assume this as your finger. This is again your thumb. This is, I'll erase all this. But you have to remember the concept 1, 4, 5, 8 towards the thumb. Always you have to remember that concept. This is the thumb. This is the back part of the thumb. So in horizontal, vertical we have seen. Vertically from down to up it was there. 0 vertical, 1, 4 towards the thumb, 1 vertical, 2, 4 vertical. And away from the thumb, this is 2 vertical and 3 vertical. In similar way, horizontal meridian, as I have told, horizontal meridian will be in the circular shape. So 0 will start here in the cuff joint. This is 0 horizontal. Again, this is 3 horizontal. And this is 6 horizontal. So this is 1. Again, you have to equally divide the points. This is 1 horizontal. This is 2 horizontal. This is 4. This is 5. This is 6 horizontal. This is 7, 8, and 9 at the tip. In the same way, on the back side of the finger also. This is 0 horizontal on the cuff joint. 1, 2 equally you have to divide the point. This is 3. This is 4, 5, 6. This is 3. 7, 8, and 9 sometimes on the nail. This is 9 horizontal. This 7, 8, 9, depending on the size of the finger, you have to equally divide the points. For some of them, it will be longer and some of them, it will be short. So you have to equally divide the lines. So these are the horizontal meridians. 0 will start in the cuff joint. This is 0. This is 1. This is 2 horizontal, 3 horizontal. I'll draw a bigger diagram. So this is cup joint. So this is 0 horizontal, 1 horizontal, 2 horizontal, 3 on the pith joint, 6 horizontal, 7, sorry, 4 and 5. After 3, 4, 5, 6 on the var joint, 7, 8 and 9. So horizontal is like a circle. 0, 1, 2, 3. To always see to that you're dividing the lines equally. 6 on the var joint, 7, 8 and 9. Like in vertical meridian, even there are 10 points in horizontal meridian also. So like I've told, this is the back part of the. So there are 10 points in horizontal meridian also. So 10 points will are again from 0 to 9. This will be 0. Center point will be 0 towards thumb 1. This is 4. Away from the thumb is 2 and sorry, this is back side of the thumb, this is front side of this thumb. On the front side, this is 0 in the center, 1 towards the thumb, 4 towards the thumb, 2 and 3 away from the thumb. 0, 1, 4, 2, 3, again 5 towards the thumb, 6 is away from the thumb, 7 is next to 6, 8 and 9 in the center. Similarly, these 10 points will come in all the 10 horizontal meridians. These are the 10 horizontal meridians, and all the 10 points will come in all the 10 meridians. So this is horizontal meridian, this is your thumb. Assume if there is a protocol like finger number 3, I'm showing it in the finger number 6. If you want to plot any point in horizontal meridian, this is your finger number 6. Assume if you want to plot finger number 6, sixth horizontal meridian, point number 4 and point number 5. So this is your finger number 6. Sixth horizontal meridian will come here on var joint. On var joint, center point is 0. This is 0. Hope it is visible to everyone. Center point is 0. Towards thumb is 1. And next to that is 4. This is 4. And on the back side, this is 5 towards the thumb. And next to that is 8. So when you want to mark point number 4 and 5 on this is sixth horizontal meridian, you can mark point number 4. You can apply magnet here on point number 4 and point number 5 in the back side of the hand. So whichever horizontal meridian you want to select, you can select the horizontal. Suppose if you want to apply magnet on fifth horizontal meridian. See, take an example, fifth horizontal. See, this is your sixth horizontal meridian. Fifth horizontal. Six will come on the joint. Fifth horizontal will come below the joint, vad joint. And you can mark the 10 points on this fifth horizontal meridian. Again, 0 in the center, 1, 4 will come towards the thumb, 2, 3 will come away from the thumb. Again at the back, 5, 8 will come towards the thumb, 6, 7 will come away from the thumb, and 9 in the center. Always you have to remember 1, 4, 5, 8 in the center. Sorry, towards the thumb. 1, 4, 5, 8 is towards the thumb. 2, 3, 6, 7 is away from the thumb. This is the horizontal concept. Vertical, you have seen it is going from down to up, and there are 10 points in each vertical meridian like this. And in horizontal meridian, it is like a circle. There are 10 circles from down to up again, and there are 10 points in each circle. Here there are 10 points in each line. Here there are 10 points in each circle. So 0 circle will start here from the cuff joint. 1 circle above that, 2 circle is next above 1. 3 will come on the pit joint. You can remember 0, 3, 6 will come on the joints. 3 will come on at the pit joint. Again 6 will come on the vad joint. In between 3 and 6, you have to equally divide the points or the lines. You can draw a circle equally, that is 4 and 5. Again above 6, equally divide 3 points, 3 lines, or draw 3 lines, that is 7, 8 and 9 at the tip. So these are 10 horizontal meridians, and there are 10 points on each horizontal meridian. Hope all of you all have understood the concept of horizontal meridian and vertical meridian. Always protocol will be in the format. First they will give the finger number. In whichever book you refer, finger number will be there, finger number, meridian name, and then the points to be plotted. Finger number, suppose finger number 3, fourth vertical meridian, 4, 5 sedate, 3, 6 stone. So vertical meridian, again, so this is fourth vertical meridian towards the thumb. So in that 4 and point number 4 and point number 5 sedate. Sedate means, as I have told yesterday, yellow magnet should be on top, and 3 and 6 on the joint. 3, 6 stone, that is white magnet should be on the top, means it should be visible to us. So 4, 5 sedate, 3, 6 stone on fourth vertical meridian. Suppose if they give finger number 3, same finger number, fourth horizontal meridian, 4, 5 sedate, 3, 6 stone. Suppose if they give the protocol in that way, which is, this is fourth vertical meridian, you have plotted point number 4, 5, 3 and 6. In fourth horizontal, this is a fourth horizontal meridian. Above third, the 3 horizontal will come here on the joint. Above that is fourth horizontal meridian. So I'll show it in this finger. This is fourth horizontal meridian. In this 4, 5 sedate, 3, 6 tone means this is fourth horizontal, point number 4 sedate, point number 5 will come at the back, sedate again, Point number 3, away from the thumb. I've told 2, 3, 6, 7 away from the thumb. So point number 3, 6 again at the back. So these 2 points you have to sedate and these 2 points you have to tone. I think all of you all have got the difference between vertical meridian and horizontal meridian. When you're plotting points on vertical meridian, point number 4, 4 and 5 will come here like this vertically. In horizontal meridian, 4 and 5 will come like this horizontally. Next we have, we'll go to MCH. We have spiral meridian also in your syllabus. Spiral meridian, actually it is the combination of both horizontal and vertical meridian, but it takes some time to understand because you have to be pakka with horizontal and vertical meridian. Combination of both horizontal and vertical meridian is spiral meridian. Easy way to locate spiral meridian points is they've given the table in page number 25. So if they give the protocol as first spiral, take it as 0 spiral, finger number 3, 0 spiral, 4, 5 sedate, 3, 6 tone. So 0 spiral, the first column is spiral column. So at the last they have given 0, that is 0 spiral. Go to that row. So you're sedating 4. Go to point number 4. Point number 4 is coming in which vertical meridian? Fourth vertical meridian. First you have to go to the spiral, which spiral they have given. So this is the spiral. Select the point which has to be toned or sedate. See in which vertical meridian it has to be plotted. Go to that vertical meridian and mark point number 4. Suppose in spiral 0, it is shown that fourth point is coming in fourth vertical meridian. So fourth vertical meridian as I've told, this is fourth vertical meridian, point number 4. This is point number 4. You have to select the vertical meridian, and in that vertical meridian you have to mark the point to be plotted. In similar way, you can select any spiral. You can take any spiral, you can refer this table, select this spiral. Suppose if they have given fourth spiral, and if you want to mark point number 0, go to point number 0, see in which vertical meridian it has to be plotted. Again, it is fourth vertical. So in fourth vertical meridian, you have to mark point number 0. All of you will know where point number 0 is there in fourth vertical meridian. So you have to go there, you have to go to fourth vertical meridian and you have to mark point number 0. Point number 0 will come in cuff joint. So this is point number 0 in fourth vertical meridian. Similarly, you can take other points also. I've given the example, you have to practice, and explanation also is given below the table. Hope all of you will have understood spiral concept also. Easy way is to remember the table. I mean, seeing the table. We can't remember the entire table. Without seeing the table also we can plot the spiral meridians. That I'll explain when I take up the next practical session. But now if you want to locate points using spiral meridian, you can refer the table, you can refer the chart. Select the spiral meridian, go to the point which has to be applied, select the vertical meridian. Here on top they have given the vertical meridian. Select in which vertical meridian that point has to be plotted, and then go to that particular vertical meridian and mark the point. which has to be applied. So this is about the vertical spiral meridian. So we have done vertical meridian, horizontal meridian and spiral meridian. Next page we have NCH on page number 28. On page number 28 of Bharadwaja, this book, there is NCH, nail chakra. So I've told you the finger numbers. So when they give the protocol, they tell NCH4. NCH4 means you have to go to finger number 4. NCH nail chakra points will come around the nail. All the 10, again there are 10 points in NCH nail chakra. All the points will come around the nail. So again same concept, 0 in the center below the nail. See 0 in the center below the nail. Again 1, 4, 5, 8 towards the thumb. Always you have to remember 1, 4, 5, 8 towards the thumb. Next to 0 is 1 towards the thumb. 4 will come here on this side. This 4 will come on this side. 5 will come above 4. Again 6, 1, 4, 5, 8 will come here at the top corner. 9 will come in the center on the top. This is towards the thumb. Away from the thumb, you get 2. This is 2, 3, 6, and 7. I'll show it. So assume this as your finger and this is the nail. So 0 will come here below, just below the nail. This is 0. Assume this as your thumb. This is point number 1. 1, 4 again towards the thumb. 5 is towards the thumb. 8 is again towards the thumb on the top. 9 will come in the center. This is towards the thumb. Again point number 2, 3, 6 and 7. This is away from the thumb. Suppose if they give the protocol NCH3, you have 4, 5 sedate, 3, 6 stone. So you have to go to the finger number 3, then select 4, 5. So these two will be sedated and these 2 points will be tone. These 2 points will be sedate. These, suppose if they tell NCH2, 1 tone, 8 sedate. So you have to go to finger number 2, NCH. You have to see which side is the thumb. So 1 tone, this is point number 1. You have to tone, that is white magnet should be visible. And 8 sedate. This is 8 on top. Sedate. So yellow magnet should be visible on top. This is NCH concept. Hope all of you all have understood all the meridians. We have come to an end. So we'll wind up the session here and hope all of you I have tried to tell as much as possible. So I mean, sorry friends, thank you so much for all your patience and thank you all. I'm sorry if I've made any mistakes or if I've not tried to convince you properly. I'll try to come with better approach next time. And thank you. Thank you all. And I'll request Ravindra sir to speak few words.
So, friends, I'm sure you have enjoyed the classes. I'm very glad that our own faculty, Miss Priyankara, has conducted the practical session so well, beautifully well. And I'm very glad all our ISHAN faculty, they are excelled in teaching also, especially in BHB category. All from first to sixth semester, all our faculty headed by Dr. Sushila Kamath and her team, that are exceedingly well. Similarly, I'm very happy now that our Priyanka also done very well. Friends, if you have any doubt, you can put your queries in your group, and we'll try to answer for this practical session related matters. And then I'm very glad to tell you from 17th onwards, between 4 to 7 p.m., 17th to 22nd, there will be classes, revision classes. There will be revision classes from 1st to 7th semester, from 17th to 22nd, from 4 p.m. to 7 p.m., 4 to 5:30, 5:30 to 7, there will be two sessions of two classes. 4 to sorry. Hello. See, from 4 to 5:30 in two groups. So, there will be totally 4 classes on each day. The exact timetable will be released either tonight or tomorrow morning. From, in all probabilities, for first semester, it will be first and second semester, it will be on 17th. And, 18th onwards, third and fourth semester classes will start. Like that, the entire schedule will be announced tomorrow. With this, you can attend the examination totally with 100% confidence. And examination, as announced earlier, it will be on 25th and 26th of this month. It will be totally objective type. A new link will be given. There will be no, it will be in WhatsApp only. It is very easy. There will be no, hassles or any confusion. In your WhatsApp number only, the questions will appear. You have to keep about just one A4 size answer paper, and you have to write the question number and answer A, B, C, D. There will be 4 choices in each question. Whatever is you feel is the correct answer, you have to mark it. That's all. For example, question number 1, there will be A, B, C, D. 4 answers will be there. Whatever is nearest to the answer, whatever you feel is right, you can mark. For example, A or B or C or D, whatever you feel like that. It will be very easy. You'll have 90 minutes time. After writing the examination, you will have to just message it, post the answer sheet to the group. That the entire instruction will be once again given in detail. And I request every one of you to kindly attend without fail. And those who are taking back paper examination, it will be on 20th and 21st. The timetable will be announced. Those who have missed the previous examination, who want to take backup paper, the examination will be on 20th and 21st. And friends, all the information in detail will be published in your respective groups. Thank you for attending this class. Please have confidence. I want you to attend the examination. I'm sure everyone will certainly pass. And in the next semester, if situation eases, then in the regular classes, you are permitted to attend even previous semester classes for better understanding and clarity. And for us, examination, getting certificate is secondary. Understanding the subject is primary, friends. We'll try hard to do, work in this line. And with this, we'll conclude today's session, and we'll again catch up on day after tomorrow for revision classes. So wish you all the best, friends. Thank you.